Hey, Dr. Dave here. Nice to be with you as always. This is the fourth installment in my series on major depression, clinical depression, syndromal depression. Keep in mind our mantra at Integrative Psychiatry: personalized treatment for the most personal of all illnesses. There is no type of suffering we take more personally than depression. All right. One of the reasons we're no better at treating depression than we were 70 years ago, I mentioned that in a previous video, is that we employ a one-size-fits-all. That's right, every type of depression that comes in the door is going to get the same treatment, and usually that's an SSRI, selective serotonin reuptake inhibitor, or an SNRI, same thing. Selective serotonin norepinephrine reuptake inhibitor. Never enough norepinephrine, but let's not go there today. At any rate, there are 227 different types of depression, 227 different endophenotypes, we would call that. For example, you can meet criteria for depression and not be able to sleep, or sleep all of the time. Does that sound like the same phenomenon? Moreover, you can meet criteria for depression, not be able to eat or eat all of the time, not be able to sit still, not be able to move. Vastly different biological entities. Now, one of the ways I personalize treatment is I measure certain psychoneuroimmunological perturbations, PNIPs I call them. What does that really mean? Well, there are biomarkers, a shorter form of that larger term. There are biomarkers in psychiatry, although a lot of people will tell you there are not. I measure thereby not only your blood, I send it to the lab, I don't measure it myself. I'm going to be looking for the usual things, making sure that I include a full thyroid panel, a vitamin D level, a measure of systemic inflammation such as high sensitivity CRP. I'm also going to do some specialty testing, about $250. It's not extensive, it's not too expensive. And that's going to look at your urine and saliva for neurotransmitters and cortisol. If I do that, take a good history, I'm going to have a very good idea of what treatment approach to offer you. And it's not going to be the same for each of you. All right, so personalized treatment for the most personal of all illnesses. How do I do that? Well, talking to you for one thing, getting a sense of your specific symptoms, and we've talked about that. We will talk more about that going forward. And then also measuring and hopefully correcting the biological correlates to your particular symptoms. Okay, that's all for now. Please come on back, stay tuned, and until then, peace out.